I'd like for everyone to think for a moment about the value of human life. And does one person's life have any more value than another person's? The current fee-for-service healthcare system rations out care based on the patient's ability to pay. I believe this is unethical. It is criminal. 95% of the country is still functioning on this fee-for-service model. I believe everyone should be treated the same. Everyone should have access to primary care regardless of their ability to pay.
Hi, I'm Dr. Faisel Syed. Welcome to another episode of Faisel and Friends. We're here because we believe everyone deserves access to quality primary care, and ChenMed needs physicians to take care of them. Today's topic is steps towards physician-centered healthcare. My co-host and moderator this evening is our Dr. Dan McCarter. Dr. Dan.
Hey, Faisel, it's great to be here with you today.
What a special show we have with our very dear friend, colleague, mentor, it's like a family member, our Dr. Gordon Chen.
Hey, Dr. Dan. Hey, Dr. Faisel. How are you guys doing?
Doing wonderful. We're so thrilled to have you here today. We received many doctors have questions. Most of the doctors that we connect with are doctors who are in the fee-for-service model, even some of them who are like in different models like direct primary care. And they want to know what are the steps that they and even healthcare systems can take towards physician-centered healthcare, like what we have at ChenMed.
Fantastic. I'm so looking forward to it. And, let me just say, I love what you all are doing. You're inspiring physicians everywhere to really take a good look at where they are right now and how they can get better at their roles in influencing positive health across this country. So thank you for what you do.
It's an honor that we can be in this position to engage, and really it's one of the learnings we had with COVID. We were forced to get onto social media. Last year we didn't have any social media, but we learned about this medium. We've been able to connect with doctors and people who are passionate about the doctor-patient relationship, partly because of that. So, well, let's get started. So, Gordon, you are the Chief Medical Officer of a physician-led healthcare practice, ChenMed. So what made you decide to create this healthcare model that puts physicians at its center?
Well, Faisel, when we think back to the early days of ChenMed, really ChenMed was birthed out of suffering. Imagine that you were told that you had 2 months to live. And so my father, the founder of ChenMed, was told that just weeks to maybe a couple months left to live, he would have, here on this earth. And so hearing that as his son, wow, time slowed down. And as a family, we really struggled. What are we going to do with his remaining days? Are we going to fight, or are we going to just let him peaceably live his remaining days? And so we went on this crazy journey to the point where we discovered that his diagnosis was wrong. He actually had a curable cancer. We had an emergency wedding. That's how I remember my anniversary. I think back almost 18 years ago now, and we decided to have an emergency wedding because we thought that my dad would have part of his face removed in pursuing treatment for the cancer. By God's mercy and grace, he's here today, right? And all the suffering that we experienced during that time, the ER visits, the hospitalizations, the neutropenic fever, the stroke, the seizures even, right? And experiencing what it's like to be really so vulnerable from a patient perspective that every detail and every day something could change. This is when we realized that despite being a family full of doctors, we were at the mercy of a broken healthcare system. And as we were experiencing this pain and this suffering, this burning desire to rebuild healthcare the right way was brewing. And we thought about our patients in inner city Miami, in Miami Gardens, who didn't have the connections, didn't have the medical training, didn't have the knowledge in the field, the networking, didn't have the know-how. How would they survive a similar type of situation? And we said something needs to change. And so the desire to just change healthcare, and then once we prove that we can change it, to then get it to all the needy communities, really birthed out of that suffering.
Wow. So, Gordon, I mean, thank you for sharing that story. It's a story that most of us inside know, but for anyone listening for the first time or learning about ChenMed for the first time, to know what really started this all off. Gordon, so tell us, how has things been? Have you been successful?
So, I think we have been successful, and really what we've been successful doing is inspiring physicians and healthcare leaders and care team members to join in the fight, right? We have a proven model that works. And what's the model? It's really not complicated. It's taking a complex thing like healthcare today, and instead of having a PCP with 2,300 patients in their panel, in some cases over 3,000 patients in their panel, we say, hey, that's not going to work. We need to simplify things, and we'll limit a patient panel size to 400 to 450 patients per PCP. What that does is it allows the PCPs to make a deep impact in not only the relationship with the patient, but in delivering better health for those patients. And we see it work time and time again. When we have mission-driven and accountable PCPs empowered by their care team and the ChenMed model, then they can reduce hospitalization rates 40 to 50%. They can help patients live, in many cases, 5 years longer or more. And they can make a deep impact in having those patients feel like they have a doctor in the family.
Gordon, the model is clearly successful. So you started in Miami over 30 years ago, 35, 36 years ago, and started scaling. Now, like what are you doing to bring it to more parts of America?
So we started first in South Florida, which some may argue is the most competitive healthcare environment, particularly for managed care. And despite the complexities of South Florida and the competition, we grew beyond anyone's wild imaginations, because things would spread quickly by word of mouth from patient to patient, from doctor to doctor. And people were experiencing the results of better health. People were experiencing a deeper connectedness, right? Doctors could connect with patients, and they would they would use these deeper connections to really help patients on their journey to better health, to coach them to better health, right? And so as things were flourishing in South Florida, we had the opportunity to grow to Virginia, and said to ourselves, we think that Virginia needs this type of healthcare, and we wanted to prove that this could be scalable. So from Virginia, there was tremendous growth and interest, in the ChenMed model, and then we continue to grow in more and more states. So today we're in over 10 states and 80 centers, and it's hard to keep track of those numbers because it seems like every week or so, the number is increasing. By the end of the year, we'll be in over 100 communities in 12 states. And I think we're just getting started.